What do you do about it if you've got the problem?
Well, it's a medical problem, and certainly we'll get into that a little bit later. It has a dental component, only in a device to help you with it, but it's really a medical problem. There are medical specialists. We have a number of good medical specialties in sleep medicine in St. Petersburg. So the person that is wanting to find out the problem really needs to go to what we call a sleep doc, or a clinic that deals with sleep apnea.
Apparently, dentists like you have an interest in this medical problem. Why is that?
Well, there's a real reason for that, and that's really how it kind of started out in dentistry. The basic therapy for no matter how it is to open the airway. And if you know this from CPR, the old-fashioned CPR that is, when you wanted to resuscitate somebody, you pull their head back and pull their chin forward, and that airway's wider, quite a bit opening there. So the dental appliance, that's what it does. It allows the jaw to move forward, which moves the tongue forward, and that airway is open. And there are two kinds of sleep apnea. We're only talking about obstructive sleep apnea. That's got to be the central sleep apnea, which is a nervous disorder. But
why does this happen at night and not during the day if it's an anatomical problem?
well, let's just, it's called sleep apnea, remember? And most people, most people don't sleep standing up. Most people are horizontal when they're sleeping. Of course, being horizontal, gravity is at work, and then, of course, during very deep sleep, there is complete relaxation of all nerval impulses, and so any kind of muscle activity just ceases. The tongue just drops back in the throat and blocks it out. Okay. Soft palate does too. You're not as vibrant in the airway passage. It's a collapsible tube to begin with. So at night, being totally relaxed during some of the sleep stages, you're really susceptible.
Are children affected by this in the same way as
Well,
adults?
yeah, and it certainly is a concern. And really, truthfully, as an orthodontist, I've spent my time with the adult sleep apnea. I really do think that we need to address the children's problems, and we can do that orthodontically real well. We have the same devices that are very, very helpful for children. We can make their airway wider by expansion, bring the mandible forward by certain of our appliances. So children, that people need to understand that snoring is not benign. Snoring is a pathology, and children that snore are showing signs they're in trouble.